What are some of the procedures which cannot be performed, like laparoscopy?
Advanced cancers, maybe.
Okay.
In those cases, you will have to perform an open surgery, or maybe certain complex hernias.
What are some of the most common health problems that people are facing?
Something which are related to GI upset, a gastritis, or maybe a indigestion or a bloating.
Are there any tips that we can give to the listeners just in their day-to-day life?
It is good to exercise in the morning, but if you're not able to do that, then have your physical activity in the evening. जरूरी नहीं है, लेकिन जो चीज़ ज़्यादा ज़बान को अच्छी लगती है, mostly it is unhealthy.
Even diseases like cancer, they are very much related to your diet.
So we have to be really careful about what we are having. Besides that, there's a lot of processed foods which we are taking.
Stay away from sugars, ekdam, yeah, not have a lot of salt, especially because it causes bloating and all. How true is that?
किसी भी चीज़ की अति is not good. Google doesn't know what is your body type. Google doesn't know what you're looking for.
Government versus private hospitals, because if I talk in the layman's terms, government hospitals बेकार है, private hospitals अच्छे हैं.
I definitely disagree to it that government hospitals बेकार है. The only problem is that government hospitals overburdened.
So hello and welcome everyone to POV Unpopular. In this health special episode with Dr. Arun Bhardwaj, talking a little about Dr. Arun Bhardwaj, he is a senior consultant at Max Super Specialty Hospital, Sector 10 Dwarka, with over 14 to 15 years of experience. Talking about his specialization, he is a laparoscopic and GI surgeon, a bariatric surgeon and also a robotic surgeon. So with so much to his head, he is not just a doctor. I personally found him as someone who is very philosophical, who has a very spiritual angle to him as well. We talked in depth about the current medical scenario in India, as well as comparing it a little bit from abroad as well. We talked in depth about his specialization, which is laparoscopic, bariatric and GI. We talked a lot about general health tips, because he himself is a fitness enthusiast as well. So like through and through, this podcast was something very knowledgeable, was something very fitness special with a lot of tips and tricks. I had a lot of fun and I hope that you all will too listening to the podcast. So stay tuned and enjoy the podcast. Hello and good evening, doctor. कैसे हो आप?
All good. Thank you so much.
Welcome to the show. First of all, so nice to have you here in this health special podcast by POV Unpopular. Okay, so before beginning the podcast, let's talk a little bit about your journey in this field of medical profession. Where did it all begin? Why did you choose medical profession and how is it going?
I would say that I didn't choose medical profession per se. The profession chose me because I think so. I was destined to be a surgeon, and I don't think so. I'm telling it because maybe I'm on camera, but I'll share a couple of anecdotes. So I'm not like that child who was having the dream of becoming a doctor someday or a surgeon someday. I was basically an engineering candidate. I have had my education done from Mumbai. So people might be knowing after 10 there is a junior college in Bombay. So, and there is something you can take up physics, chemistry, maths, or you can take a PCMB.
Yeah.
So I had taken physics, chemistry, maths. I had eliminated biology completely. So then there was this last list of the topmost college. So there I got a PCMB and I couldn't get PCM. And that time my father was at Kailash Mansarovar. So I had a telephonic conversation with him and he told me कि बेटा ले क्या पता देख लेते हैं आगे जाके कुछ change हो जाए. And now that has changed my life entirely. And the second one is basically till the mid-12th, I was preparing for engineering IIT. But by the start of 12th, I had a lot of interest in the zoology part of it, the human anatomy. It was intriguing me a lot. And my interest was shifting a little bit to that side. My brother, my elder brother, he's the first doctor in our family. So basically, he was in his second year MBBS. So he came for a break from his college. And we had a one-to-one discussion at night. And in the morning, I tell my dad, Papa, मुझे engineering नहीं करनी, मैं medical field के लिए prepare करूँगा. And that's how in the later half of my 12th standard, I shifted from being a hardcore IIT student to a medical student. I prepared for 6-8 months, but diligently and very sincerely. And I could crack my MBBS entrance exam in the first attempt and then join college, and rest is, as they say, is history.
Wow, so it was just meant to be, as you said in the beginning.
Yeah.
Okay, so talking a little bit about the medical field in general, you know, you have to first of all study so much if you want to be a doctor. And then, of course, once you join the medical profession, also it's very hectic as we keep hearing. So what is it like? And you know, if let's say today a 20-year-old kid comes to you asking for an advice that should I be a doctor, what would you suggest to this
Yeah, so
20-year-old?
a well asked question, because that is something, there are kids who come up to us, their parents, they come to us and ask के मेरा बच्चा है ये मेडिकल फील्ड में जाना चाहता है, आप क्या कहना चाहेंगे, या जो भी है. कई बार इट्स द पेरेंट्स हु आर प्रेशराइजिंग कि मैं चाहता हूँ, हम चाहते हैं कि मेडिकल फील्ड में जाए.
Correct.
तो आप इसको थोड़ा समझाइए. So the first question I always ask them and their parents is why the kid wants to be in the medical field. Because this field is not that simple. It is something which is a really long process. So you need to seriously have love for the subject.
Correct.
You need to have a good reason why you want to be in it. If you are thinking about monetary gains, then I would say कि it will definitely give you a stable life. It will give you a good financially stable life. With years, the best of the best surgeons or the best of the best doctors will have a really good monetary outcome out of it. But most of them will be having a good, decent life. So if you're into it from the monetary point of view, then sorry, that's not the reason that you should be in this field. You should have the love and the passion for that medical science. And if you feel that yes, you'll be able to, not per se when they say okay, we'll like to help the poor and downtrodden or something, that need not be necessary. You should be able to, you might be able, you'll be happy just helping out or maybe healing someone. So that is a kind of a power that we have got. Okay, as surgeons, that one of the reasons that you asked me okay, basically why did you become a doctor. So that was destiny, was one part of it. But then the other aspect to it was that basically I felt empowered that that I have got that power to heal someone, to cure someone, that God has bestowed upon me that strength and that power and that wisdom, so that I can make a difference in someone's life. So that which He or the Almighty can't do directly, indirectly it is being done through me. So I have to try to do it to the best of my ability. And as I told you, it's a difficult life. From the education point of view, I'll tell you, till the age of 29-30, I was giving my exams. And I'll tell you, by God's grace, I've been a bright student. I never had a break anywhere after my MBBS to MS to super specialization. But still, till the age of 29-30, I gave my last exam. So you have to realize it's a real long life, a real long, tough life. And even after that, there will be times that you will be doubting your ability. There will be times that it will have a toll on your mental as well as physical health.
Correct.
Because you somehow get attached to the patients, to the patient, to their relatives, to the outcomes, and you want to do the best. But it's not sometimes in your hand. You have to realize that result is something which you can strive for, but it is not in your hand. You have to realize that there is a destiny part to it. There is basically someone else who is pulling the strings. You do it to the best of your ability. You try and do what you can do at the best and then leave it. So that is the mantra which has worked for me till now and in the future also, that I don't take too much pride in my success, and neither I get disheartened by my failures. Because if my failures or my complications, they dishearten me and pull me down, then how will I be able to get up and hold myself together and do even better? So your failures should make you learn. You have to overcome them. You have to go beyond that. If you have failed, then you have to introspect that why it happened and how I can avoid that happening in the future. So that's how you have to move forward. So it takes a lot of maybe toll on your mental health, also physical health. But that's the reason why you need to have certain other things in your life, good hobbies, maybe not be too attached.
To the outcomes especially.
Yeah, to the outcomes especially. Okay, so as I always quote that Lord Krishna's Gita, when Lord Krishna said कि भाई कर्म कर फल की इच्छा मत कर, I interpret it in a different way. I don't say फल की इच्छा मत कर, फल की इच्छा हर मनुष्य करेगा, पर नतीजा आपके फेवर में हो, इसकी इच्छा मत रखो.
Correct.
मुझे भी when I am trying to treat a patient or heal a patient, I definitely want him to get better. तो मुझे फल की इच्छा हमेशा रहेगी, लेकिन हाँ उसको बेसिकली वही हो, ये मैं जिद नहीं कर सकता. हाँ अपने एफर्ट से I can try my level best to get that outcome in my favor, and most of the times if you're true to yourself and if you have done your best, most of the times you will have a favorable outcome. कभी कभी ऐसा होगा, sometimes you might not have a favorable outcome, but that, जैसे मैंने कहा कि it is always a learning experience. You should try to introspect see कि क्या हुआ था, what else I could have had done, take multiple opinions. Like I have been fortunate enough to be working in teams for so many years. So team culture is something which I always advocate, because you will have a good mix of an experienced person, maybe a younger person who has better knowledge, maybe at that point of time, a middle-aged person who is a middle part to both of them, and then you can have a another perspective also. Your mind, when you're operating or in the post-operative period, when the patient is healing well or is trying to get out of the disease, that time your mind is working in only one direction, so you need other perspectives also.
Correct.
So that's why a team helps you work better that way.
And we were talking, I think, off the cameras, that especially in the medical profession, you don't see a lot of team culture, is it, these days? Yeah,
absolutely.
That's something.
In Delhi, I have seen there is a lot of team culture.
Okay.
In certain cities, like in Bombay, it is not that much. So I'm not pointing out per se, but I think so somewhere down the line, I think so people, the clinicians, the doctors, they feel that it might hamper their growth. Maybe monetary wise, maybe they are not that comfortable gelling with others. But if you have a good team where you're gelling with each other well, then you will supplement or complement each other really well, and it benefits, it adds on to your care and to your expertise towards the patient. So team culture, I am always for it. And you can also have your burden shared. So basically, when I'm in a team, so everything doesn't fall onto me.
Correct.
I need rest. I need maybe some vacation, maybe once or twice in a year. So what about my patients then? If you're having a team, so the team can take care of those things, and you can have your breaks, so that can keep you sane at times. So that team culture, it is always definitely beneficial, no doubt about it.
Correct. So before moving on to the next question, I think my takeaway to anyone who wants to perhaps join the medical field is to actually know the why.
Yeah.
And if your why is good enough, if you have the right why, then only perhaps pursue the medical career.
Absolutely, absolutely.
Okay. So now talking a little bit about your specialization, you are a laparoscopic and bariatric surgeon.
Yeah.
Okay, first of all, what does that even mean?
Yeah.
In the
So
layman's
basically,
terms?
in a normal person's language or a layman's language, laparoscopy means something called as a keyhole surgery. When we say that there are small cuts, really small cuts, and vis-a-vis where in open surgery era, now also there are certain procedures that will do open with the long cuts which are there. So these procedures are done with really small cuts. So people always ask, then how do you perform them? So basically, there are certain ports which go through those cuts, and you have stick-like instruments. And with those stick-like instruments and a good maybe a 2D or a 3D vision system, you can see everything which is there inside, and that is how you operate.
Okay.
So basically, laparoscopic surgery is something which has made the surgical field and the operations quite simplified with regards to the recovery of the patient. So it is responsible for a faster recovery with lesser pain, better cosmesis, and early return to work. So why early return to work is important? Because when you see in private sectors or most of the sectors, so the first question that the patient asks कि मेरी recovery को कितना time लगेगा? Because पहला जो उसका question दिमाग में आता है कि मैं कब join कर पाऊँगा? Because there is a financial loss attached to it. You are having a disease. As such, disease की वजह से भी you are having spending either insurance, either cash, or either panel, whatever it is, and how much work day loss you will be having. So with laparoscopic surgery, and now even there are more advancements going towards robotic surgery, this thing has quite fast forwarded. So the recovery is really, really fast. So that is what basically laparoscopic surgery is. So most of the procedures can be performed laparoscopically now.
What are some of the procedures which cannot be performed like laparoscopically?
I can say certain advanced cancers, maybe.
Okay.
In those cases, you will have to perform an open surgery, or maybe certain complex hernias.
Okay.
Really, really complex hernias. Though we have advanced so much that even the complex hernias we can perform laparoscopically or robotically, but yeah, there are certain procedures that have to be done, and certain procedures in emergency setting, where you might be having a hole in the intestinal perforation, and the patient is presented late. Or certain patients where you will be having an obstruction with a absolutely bloated abdomen. So you will not be able to put those scopes safely, the port safely. So that time you will have to do open surgery. So trust me, open surgery has no replacement to it. In a laparoscopic or a robotic procedure, if you are stuck, then you have to go to the basics. You will have to open up the patient, and the safety is paramount. Early recovery, faster recovery, and shorter hospital stay, all those are important, but your result can't be compromised.
Correct.
So in any case, if you feel like a laparoscopy or a robotic procedure is not doing justice and you need to open up and convert it, then you have to do it, and that's why you have to be trained in that. So it's not that you can keep on running. You have to start from walking and then run. So
Correct.
sometimes in the current era where you have those newly educated surgeons, so they are doing a lot of laparoscopy procedure, but they have never seen the same procedure being done open. I'll give an example. It's like a gallstone surgery. So now the gold standard is a laparoscopic cholecystectomy, which is laparoscopic removal of the gallbladder with stone. So the newly educated surgeons who are there and trained, they have done all laparoscopically, but if they have to open, then it's a big dilemma for them because they haven't seen, they have hardly seen 5 or 10 surgeries being performed in an open way. So that's why you need to have that knowledge also. If that situation arises, then how I would do. So that is what is laparoscopy. And the second what you ask about is bariatric surgery. So basically bariatric in again normal terms, it's a weight loss surgery, but it is not just weight loss. So bariatric comes with a terminology called as a metabolic surgery.
Okay.
So it basically not only focuses on weight loss, but along with weight loss, it also focuses on changing metabolism, changing the metabolism of your body. So that is how it does, is basically certain mediators which are there. So there are certain hormones which are something called as a ghrelin, which causes, obviously there are certain hormones which send signal to your brain that I am feeling hungry, the stomach is empty, put something into it. So there are these procedures which can basically bring down the ghrelin levels. There are these procedures which can bring up the level of certain other mediators which helps to release more insulin. So these bariatric procedures not only help in weight loss, but they help in improving the diabetes. In fact, maybe cure it. Improving the blood pressure of the patient, improving the liver disease. If these patients usually have these obese patients, these are basically really obese patients, so they have fatty liver. So that fat deposition that gets reversed. There are patients, I have been fortunate enough, I have operated quite a few of them, female patients who are having PCOS. So as everybody knows, PCOD or PCOS, polycystic ovarian disease, it is basically related to obesity. So these patients, these female patients usually have PCOD and they have infertility because of that. So they are not able to conceive. But there are a couple of my patients who after the weight loss surgery, within 6 months to 1 year, they conceived. Though I had told them for 1 to 1.5 years, they are not supposed to conceive because they are losing weight for at least 1 to 1.5 years. So it has to stabilize first. But yes, they
because
conceived.
of those hormones they keep losing. Yeah.
The hormones and the disease process itself.
Okay.
So usually these procedures are not a quick 2-minute Maggie sort of thing. You go inside and when you come out, you are a new changed person. It's not that way. It's basically your food intake is reduced. These mediators are increased. With time, certain are decreased, certain are increased. And over months, the next few months, initial weight loss is quick, and then it is a little bit slow and steady weight loss which is there. And by 1 to 1.5 year, you have the desirable result. Beyond that, it comes to a static. And after that, then you have to maintain it with a good, healthy lifestyle, with the exercise, with the dietary regime that is required. So basically, just bariatric surgery is not weight loss surgery. It is not only weight loss. It's not like something, a cosmetic procedure. Cosmetic procedure like liposuction or tummy tuck or maybe all these fat reducing procedures which are there, they are basically to reduce those 5-7 kgs of weight to get you back in shape. But I am talking about those patients who are really, really healthy, like 150 kgs, 180 kgs, 200, 220 kgs. So these patients will not benefit with these procedures like fat reducing or a liposuction or maybe some injections. So,
and there are certain pills also, like weight loss pills available in the market. Do you even like ever recommend those?
I have, but basically these pills, you will have to understand. First, they can't give you that much of a weight loss. They can give you maybe a couple of kgs, maybe 5 to 10 kgs. And in the recent times, the pharmaceutical companies are even coming up with certain injectable medications which are being used outside, which were initially prescribed for maybe diabetics also, and then now they've realized it causes good weight loss, but still the weight loss is almost 10 to 12% of the total body weight. So not much, and then it has to be taken lifelong. So what happens is you have a habit of, you will take it for a couple of months, 3 months, 4 months, 6 months, and these are really costly. And by 6 months, 1 year, you will stop it, and then the weight rebounds. Sometimes it even rebounds more than what you initially were.
Correct.
So that's why you will have to take it with a pinch of salt. So that is the reason why you have to consult an expert regarding that. So maybe a bariatric expert, maybe a weight loss person who is not biased. So basically, you will always have two school of thoughts. A surgeon, a bariatric surgeon, not necessarily, he'll not only talk about surgery. So there are certain patients, we have certain set criteria that these patients will benefit out of bariatric surgery. If a patient maybe with a BMI comes to me of 29, 30, then I tell them bariatric is not the way for you. So there are certain lifestyle and exercise and maybe these injections or maybe a balloon, these are certain things which are minimally invasive things that can be performed.
So, talking about your field of work, what are some of the most common health problems that people are facing in today's times?
I think so. The most common ones are something which are related to GI upset, a gastritis, or maybe a indigestion or a bloating, which is they always complain of.
Just sort of like always overlooked.
Yeah, absolutely. Everybody feels that this is something which is a part and parcel. कि हाँ ये तो होना ही है, थोड़ी गैस तो बनती ही है. And one of my senior surgeons used to tell me कि even a 4-year-old child has that habit of telling कि मुझे गैस बन गई है. How a 4-year-old child knows that? Because घर पे पापा मम्मी हर बार यही बोल रहे हैं कि मेरे पेट में गैस बन गई, मेरे पेट में गैस बन गई. So it is that common, and sometimes it is overlooked because these are certain subtle signs and symptoms of a bigger problem. Like I'll tell one example. One of the commonest surgeries that as a GI surgeon I perform, it's a gallstone surgery. So removal of the gallbladder with the stone. And the earliest symptom that it comes up is with indigestion and bloating. So and and these things can blow to really big proportions. That a gallstone can result in problems like a pancreatitis, maybe a jaundice, or maybe even cancers. I had seen one patient of mine. She was a 23-year-old girl. She was having this indigestion problem for a really long time, and she came to us in emergency with pain abdomen, severe pain abdomen. We got her admitted. So she had got pancreatitis, which is inflammation of the pancreas, and it is one of the worst diseases in the abdomen because it can vary from a really mild attack, which requires a couple of days hospitalization in the ward and some medications, to a serious attack where the patient might need to be in the ICU. So this girl had a pancreatitis, which was basically because of a stone that slipped into the common bile duct, and then she needed an endoscopy. She was there in the hospital for 10 to 12 days. On the CT evaluation, she lost almost 40 to 50% of her pancreas, which secretes the insulin. She is now a diabetic for life.
Wow.
So indigestion, which was not taken care of, and a simple ultrasound could have picked up that disease, and she could have had got the surgery done in time. She got the surgery done, but that time the damage had already been done. तो जो होना था वो हो चुका था. तो इसीलिए we sometimes overlook these simple symptoms.
Correct.
So indigestion and bloating is something which is quite common. Then I think so it's constipation, which is something most of my patients keep on complaining about. A chronic constipation, GI upset, which is there. Certain anal issues happen because that piles and fistulas and all are there. And then gallstone, as I say. So basically, these are all related to the lifestyle which we are having nowadays. It's the diet that we are having.
Yeah, and I just wanted to add, a lot of the serious diseases, they actually begin in the gut, if I'm not wrong, right?
Absolutely.
So you have to like really take care of the gut.
Exactly. So as I was telling, when you are having these problems such as the GI upset which is there, if it is overlooked for a really long time, even certain these simple symptoms can point towards cancers in the later stage.
Wow.
So we have to realize that the smaller things we just can't overlook. And now we are having a lot of stressful life, a lot of junk food that we are taking, and the schedule is really bad. Schedule in that sense about our eating schedules which are there. So you have those corporate cultures which are desk jobs where you are not much into physical activity, into exercise. And then you are having call centers and jobs where you are having really grueling night shifts which are there.
And not even like job. I think people, they're just habitual of coming back from work and just opening Netflix and sitting. That's all.
Exactly. So they are sleeping at 2 o'clock or 4 o'clock at night. And that's the time where you are binging.
Yeah.
So you have your dinner at 8, 9. And then you have that urge again at 11, 12. So when basically our ancestors, our elderly people in our family used to say early to bed and early to rise. So that is what they meant. You have an early dinner. So now we are coming with those dietary plans where they say that have a dinner at 6 or 7 o'clock. So if you're having a dinner at 6 or 7 o'clock, and if you're awake till 3 o'clock, how can you be fasting for that long? So that is what happens. So it has to be an early to bed and early to rise. So try to sleep by around 10 or 11 at night. Try to get up at 5, 6 in the morning. You will have enough time throughout your day. You will have a good 16, 18 hours in your day. Everybody complains that मुझे exercise के लिए time नहीं मिलता है. वो exercise के लिए time इसलिए नहीं मिलता because आप रात को सोते 2 बजे हो. You get up at 8:30, 7:30, 8 o'clock. You rush to the office or to whatever your workplace at around 9 o'clock. So you don't get that time. So you have a really big day if you sleep on the right time and get up at the right time. So you need to realize, and then those binging things and those unhealthy habits that you're having, that thing can be taken care of. So as you said, all these OTT platforms and those web series and everything. So Absolutely, it is entertainment, which is definitely you can have it, but then not at the cost of your health.
Correct, correct.
So that is what is happening.
So, perhaps with this, are there any tips that we can give to the listeners just in their day-to-day lives? Like what else they can do? One is, of course, sleeping on time, getting up on time. And also with this, I think erratic sleep schedules, they're also responsible for a lot of diseases in the later stages,
Exactly.
right?
So basically, what I can tell to the listeners is basically I am also into fitness. So
Yeah.
I work out 5 days a week. So have a schedule for yourself. Something which works for someone might not work for you. It is good to exercise in the morning, but if you're not able to do that, then have your physical activity in the evening.
Correct.
Try to find out time for that, at least 4 to 5 days in a week. If you're into walk, then I always tell my patients just walking and having the stroll in the parks with those aunties specifically are having and chit chatting those
And they
walks
say, कि हाँ हमारी exercise हो
yeah,
गई.
those walks are absolutely useless. I'll tell you why. Basically, because you start burning your calories 20 minutes after a good brisk walk.
Okay.
And when I tell brisk walk, I'll tell only one thing to my patients. Brisk walk means either you can walk fast or either you can talk. If you are able to talk comfortably, मतलब it's not a brisk walk. Because अगर आप बहुत तेज चल रहे हो, you will have shortness of breath when you're talking. तो उतना फास्ट चलने के 20 मिनट बाद तो कैलोरीज बर्न होनी शुरू होती है. So by at least you need a good 40 to 50 minutes of a brisk walk. So try to find out just 1 hour of your schedule कहीं पे भी, and at least try to have it 4 to 5 days a week. I don't advocate for 7 days a week because then you will have dropouts. Okay, so have a schedule which works for you. So one is basically a good physical activity. Second, try to stay away from junk foods as much as possible because जो चीज़ unfortunately ज़रूरी नहीं है, लेकिन जो चीज़ ज़्यादा ज़बान को अच्छी लगती है, mostly it is unhealthy.
Correct.
लेकिन ऐसा नहीं है, you don't have healthy alternatives. So that's why you need to have a good, अगर basically if you are very erratic with regards to your diet, then have a good chat maybe with a good dietitian or a nutritionist so they can give you all options, the healthy options which are there. And third is basically sleeping on time. I know with your night shifts and everything it can be difficult, but the rest of the two things can at least be taken care of. And those who are not having night shifts, then they can I think so postpone the OTTs and the web series and everything which happen late night time. No? So basically that I think so they can maybe space it out.
Correct, correct. And also, correct me if I'm wrong, like, especially these days on social media and everything, it's like even diseases like cancer, they are very much related to your diet. And people are advocating like keeping fasts a week, like perhaps 1 day a week, etc., to actually ward off these diseases. And also, how good is it actually?
I would say I don't think so fast a week would help much. But तभी मैंने कहा कि these diets ना everything
Sort of
has
like
to be under
detoxifying your body, like
yeah, but
that
I think so.
ways.
If you're taking toxins for 5 days and then you think that one day you can detoxify, then it's a difficult job. So you need to understand that basically there are certain dietary things like when we say about smoking, when we say about alcohol, when we say about really obese people. So these are certain conditions which give these are certain pro-carcinogens. Pro-carcinogens means something which potentiates those genetic mutations which get which cause cancers. So basically they are not themselves the causative factor, but yes, they can definitely fuel fire to those agents which are there inside your body. So that's why we have to be really careful about what we are having. Besides that, there's a lot of processed foods which we are taking. So those processed foods have to be avoided. There's a lot of preservatives, lots of chips, lots of all those things which are, as I told you, those things which are very tasty and something, most of the times they are not that healthy. So we have to stay away from these junk foods. Definitely once in a while you can indulge, but it's not that 5 days you are indulging onto this and then 1 day or 2 days you are on a healthy diet and you feel that yes, I have detoxified myself. So sorry my friends, that's how it doesn't work. It doesn't work that way.
Okay, and how about like sugars and salts? People sometimes they say like stay away from sugars, ekdam, yeah, not have a lot of salt, especially because it causes bloating and all. How true is that? Like,
yeah, definitely. Don't stay. I always advocate that everything in moderate amount never causes any problem. It's the excess, या जैसे हम कहते हैं अति, किसी भी चीज की अति is not good. So anything if you're taking more, a lot of sugar obviously have an issue. A lot of salt obviously will have an issue. So small quantities, and as I told you, that's the reason why I told about processed food, because they are really very high in sugars.
And you don't realize it.
Yeah,
like,
you don't realize it.
Yeah.
They are high in sugars, they are high in salts. So basically that is something, that's the reason I'm telling you, okay, stay as natural as possible. Have good fiber in your diet. That is important. So a lot of green leafy vegetables, veggies you take. So patients, we have a lot of patients that I have patients who are having anal issues or with constipation. So I always tell them to take fibers. So it is very easy to say to the patients कि आप fiber ले लो, but fiber का मतलब क्या है? So I tell them have a plate of salad daily. A plate of salad in a diet, and that salad can keep on changing. You can have maybe kakdi, kheera, tomato types, or you can have maybe a papita, an apple, or maybe some broccoli, or maybe so have at least a single diet of a good salad. And then beyond that you can have certain complex carbs and even the fat. Sometimes what we say कि कहते हैं कि भाई fats पूरा छोड़ दो. There are certain fats which are called as PUFA, which are polyunsaturated fatty acids, which are like omega-3, 6 fatty acids. So there are certain sources which, if you are non-vegetarian, fish is a good source for it. Then you have those chia seeds or maybe those flax seeds which are there, or then you are having walnuts. So these fats are good. They help you to maintain your weight also, and the body requires it. So that's why I always say, just don't listen to WhatsApp Gyan. Don't have everything. You cannot get every answer from Google.
Correct.
Okay, Google doesn't know what is your body type. Google doesn't know what you're looking for. Google will give you a general overview. So that general overview has to be seen through a magnifying lens for your requirement. So that can only be done by a specialist. So you need to go to a specialist for that. So that's why a lot of Google Gyan patients come to me. So first I have to wash that out. But I don't directly try to offend them by telling कि ये चीज़ भूल जाओ. I just ask them कि yeah, you tell me what you know first. So then I take the advantage of that Google Gyan. कि जो 50% अच्छा उन्होंने पढ़ा है, the something good that they have read, yes, I'll use it. I'll not have to reiterate that. But then the rest 30, 40, 50%, whatever is wrong, then I tell them कि ये चीज़ नहीं करनी है. I'll give you just one anecdote. There's this one patient, a gallstone surgery was done a week back. Okay, so he followed up 2 days back, and the surgery went well. It was a bad gallbladder. Okay, but by God's grace, the surgery went well. The next day he was discharged. So he came back to me after a week, and he told me, "Sir, I feel that I was hasty with regards to the decision to get it operated upon."
Okay.
And then I gave him those couple of examples. One of this girl which was there, and one of another patient who underwent a later gallbladder surgery. The biopsy was not seen, and now the patient has a widespread cancer.
Wow.
So basically, I told them about these two things, and then he told me कि yes sir, Google ने तो मुझे इतना ही बताया था. Yeah, there were certain relatives who told them कि हाँ. For him, his course in the hospital and post-operative period was absolutely smooth. That's why he felt कि यार मैंने ऐਵੇਂ ही करवा लिया. But as a clinician, as a surgeon, I know कि नहीं करवाने पे क्या क्या हो सकता है और कैसे हम उसे avoid करें. So that's why the expert advice is definitely required and definitely recommended. So जो free advice रहती है, I always tell my patients there is only one thing which is free in this world, that is advice. And everybody gives it.
Yeah.
And trust me, जिसको कम ज्ञान होगा वो ज़्यादा देता
है. Correct.
कि मेरे उसके साथ वो हुआ था, मेरे उसको भी ये हुआ था, आपके उसको जो हुआ था, the disease process was different. The stage might have been different. आप जिसमें आए हो, it might not be similar. क्या पॉसिबिलिटीज़ हो सकती हैं, क्या कॉम्प्लिकेशंस हो सकते हैं, वो उनको नहीं पता है. दे जस्ट हैव अ एनेक्डोट, एंड वो भी विदाउट एनी साइंटिफिक बैकिंग टू इट. बस ये एक एक्सपीरियंस था. तो वो बहुत सारे क्वेश्चन मार्क्स डालने वाले आपको लोग मिलेंगे. बट ट्रस्ट द एक्सपर्ट, हैव अ गुड ट्रस्ट रिलेशनशिप विद योर डॉक्टर. मोस्ट ऑफ द डॉक्टर्स दे ट्राई द लेवल बेस्ट टू हेल्प यू in the maximum possible way.
Okay. So moving on, if I talk about India as a country, how's the medical infrastructure of India currently as compared to perhaps any other foreign city? And what are like the advancements that you see in your field?
It's on par with any other country. So basically, sometimes we downplay what we have at our basically disposal. Sometimes we feel कहते हैं ना घर की मुर्गी दाल बराबर. So basically, you sometimes feel, but we as clinicians and surgeons, we attend conferences abroad, and their surgeons, they do come. Like next month, we are having an obesity conference in Mumbai. So that's a international conference where we'll be having a lot of international faculty will be coming here. We'll be sharing they'll be sharing their experiences. We'll be sharing our experiences. So with regards to infrastructure, we have almost all the facilities which are there abroad. The expertise also is also on par. So basically, पहले होता था कि भाई कुछ issue है या कोई cancer है, तो we have to go abroad. But then now we have everything available here with regards to even good cancer drugs with the surgical expertise. So we need not rush anywhere. The only thing I think so with time which is getting lost a bit is having trust. You need to have trust or faith in the medical system. The government also, it is doing, it is helping a lot with regards to these. There are a lot of grants also. There's a lot of research which is going on, and mind you, India is really quite ahead with regards to the research, because the one reason being is basically the population and the numbers that we have.
Correct.
So COVID, I think so. COVID, though there were catastrophe everywhere in the world, but India handled it quite well, considering the number of people that were there, and they came up. They were the fastest people to come up with a vaccine, which was initially disregarded
Correct.
by the I think so by the foreign pharmaceutical companies. Were disregarded. It is not something which is on par. But later on, they had to take back their statement. So basically, there's a lot of research which is going on. You have all those equipments which are available. As we talked about laparoscopy, so basically there is something called as robotics. So a lot of interest now is amongst the patient that how these robotic procedures happen. So it is something which is an advancement over laparoscopy. So we don't have a single robotic platform. We have multiple robotic platforms which are available in almost every hospital. So that is something which makes a surgeon's life as well as his expertise better. So it gives better outcome. So why think about or rushing to other countries when you have all the facilities available here? So that's why, no doubt about it, we have almost everything on par with what you can get abroad, maybe in US or maybe Europe. So there is no difference as such.
आपने कोविड का नाम लिया, so do you think that people's immunity in general has decreased after COVID? Because we are reading this thing a lot on social media everywhere कि after COVID, people don't know why, but the immunity has decreased. People are diseases are more prevalent now. Is it true? Does it have any
There are no strong scientific evidences backing that, but yes, there are cases which are there. You are having certain lung issues which were not there, and there is nothing clearly proven. But definitely there is something, there is some fuel to the fire, that there's something which might have been, there are certain sequelae, as I can talk about it. There may be certain sequelae of those COVID problems that they were having during that point of time. And more so patients who are obese. There was a lot of, in the second wave, it was quite unfortunate to have a lot of mortality, and we lost quite a few patients. Most of these patients were either having a unhealthy lifestyle with having multiple medical problems, or maybe they were too heavy. So obese patients. So that's the reason why I focus upon that. Any kind of disease comes to you only when you are not in a shape to tackle it. Your body has a good amount of an immunity system, but then that has to be taken care of.
Correct.
God has given you a great, I feel so, I think so, there can be no better engineer than God. He has made such a complex human body, and as medicos, we keep on learning about it for life and life and life. Basically, the whole life goes, and there are advancements. We are trying to understand it more, and He has made it such a complex kind of a thing, and still, and no two persons are same, not even in the family, except for maybe twins who are looking same, still their genetic makeup might be different. So such a complex thing, and He has made it so well. So that's why we should be thankful to God for the way that it has been happening, but then we need to cherish it. We need to take care of it. We are the ones who are responsible for ruining it.
So आपने immunity का नाम लिया. So बहुत सारी बार there are certain घरेलू नुस्खास to to improve your immunity. One example can be having turmeric or turmeric milk. Does that work? And are there really certain घरेलू नुस्खास or spices?
Definitely they are there. I'll tell you why. Because when a patient comes to me with regards to a problem and he says कि sir ये चीज़ ऐसे ऐसे है, मैं again वही कहता हूँ कि you need just an expert advice. I never say Ayurvedic science is not good. I never say homeopathy doesn't work. I always say yes, these are good, these have been there for so many years, but you need good practitioners who can guide you with regards to that. So somewhere down the line, when we have a science which is there for years and years together, maybe before allopathy, we are having this Ayurveda which have been there for really, really long time. So how I can just dismiss it saying that allopathy is good and it is not? It's just basically because of certain black sheep who don't know about it, or maybe try to have certain financial gains and then disrepute it, put it into a simple example. Gallstones, unfortunately, good Ayurvedic, homeopathic practitioners and the allopathic surgeons, they know that gallstones have no cure. It requires a surgery. Okay. Those gallstones can't be dissolved as of yet anywhere. It requires a gallbladder with a stone removal. But you will always find quacks who will keep on telling कि हम stone गायब कर देंगे. You will always see those videos in WhatsApp where through the belly button or through the navel they show that the stones are popping out. And your stones, I recently saw it maybe a couple of days back. So you have those nonsensical kind of things going on, and people believing that.
Yeah.
So because in my practice I have seen, आप अगर surgery बोलोगे, operation बोलोगे ना, the patient is on a back foot.
Correct.
आप उसके अलावा कुछ भी बोल दो,
Hmm.
आप दवाई बोल दो, आप झाड़ फूक बोल दो, आप बंगाली बाबा बोल दो, कोई भी चीज़ आप बोल दो, लेकिन अगर आप सर्जरी बोलोगे तो बेसिकली एवरीबडी इज ऑन अ बैक फुट एंड दे आर स्कैर्ड ऑफ इट. सो एज अ सर्जन आई ऑलवेज ट्राई टू मेक देम एज कंफर्टेबल एज पॉसिबल, गिव देम द चॉइस. जैसे अगर उन्होंने मुझे बोला कोई चीज़ मुझे लगती है कि अगर आयुर्वेद या होम्योपैथी से बेटर हो सकती है, तो मैं ये कहता हूँ कि कंसल्ट द राइट पर्सन, go to that person. That is a science which I don't understand well. So I am no correct person to talk about it. Similarly, I don't want that person to be talking about my field when he doesn't have that knowledge. प्रॉब्लम ये होती है कि वो जो है बेसिकली कई बार वो लोग डिस्ट्रीब्यूट में डाल देते हैं कि ये तो भी आपको डॉक्टर बोल रहे हैं.
अब आप डॉक्टर के पास गए हो तो वो बोलेगा ही.
So basically when you don't talk about my field and I don't talk about yours, you be the best in yours, I'll try to be the best in mine. So that's what I really believe in.
Correct. And you know, in my personal opinion, Ayurvedic science, it works better as a prevention rather than a cure.
As a cure also we might be having certain, and it might be also supplementary. मतलब there are certain things के जैसे हमने कुछ सर्जिकली कुछ हुआ या एलोपैथी को हम उसके साथ में सप्लीमेंट कर सके, it will be a really good initiative if we can have both the sciences basically amalgamated into each other. Okay, but yes, the courses are different. बीच में जैसे आ रहा था कि we can have certain allopathic courses जो हम आयुर्वेदिक को करके कर सकते हैं. So it is not that easy. मतलब 6 months, 1 साल में आप वो चीज़ नहीं कर सकते. It is difficult. So that government needs to understand. But हाँ, somewhere down the line, if we can get the experts of both the fields and we can somehow make a mishmash out of it, तो उससे क्या है कि the patients can get the benefit of it. तो मुझे वही लगता है कि सीधा मना करना कि नहीं यार वो तो ऐसे ही है, उससे तो कुछ नहीं होने वाला है. हाँ, सर्टन डिजीजेस हैं जिनमें नहीं हो सकता, तो नहीं ऑप्शन है.
करेक्ट.
तो वो अगर उसको हम कर सके किसी तरह, तो इट विल बी अ गुड ऑप्शन. इट विल बी समथिंग व्हिच विल बी वेरी फेवरेबल फॉर द पेशेंट्स.
Correct. Okay. So before moving on, let's have a quick round of rapid fire round.
Okay.
This is not about your medical field per se, but this is more about you, a fun round with you.
Okay, chalo.
Okay. Okay, so we'll begin the rapid fire round. My first question is your favorite book.
One, or maybe I can tell about maybe a couple.
How so many you want to say?
Okay, so I would say that something which excited me about the medical field was there was a book called as Doctors by Eric Segel.
Okay.
So that is something which I read in the early part of my 12th. I think so that was also one of the reasons why which excited me towards being a doctor.
Okay.
So that is one of the books. Then one is Wings of Fire, which is the autobiography of APJ Abdul Kalam. So such an inspirational book. And maybe I have not read in detail, but Bhagavad Gita. Okay. So that is something which I have read when my mom passed away. So that is something which I read at that time. Okay. And it is something which gave me a perspective towards, as I always tell, the karam kar fal ki ichha mat kar.
Larger than life perspective you can actually have from
Bhagavad Gita. So basically these are something which have always inspired me or maybe guided me.
Your favorite TV series or movie, if you watch any?
I watch a lot of them. Yeah, but I space it out. I used to see, there was a TV series which was called as House. So it was basically about Dr. Gregory House. So that was a medical series which was really interesting. Okay. So then I revisited one TV series which we always have a nostalgia about during the COVID days. That was Ramayana and Mahabharata.
Okay.
So I definitely enjoyed that. Even I enjoyed the newer version of the Mahabharata. I try to, because all these, I think so, okay, you can always have certain things from these series also, there's always a learning.
Correct.
It's just that you should be having that hunger to grasp that point or to have that knowledge.
Correct. So, you know, it's sounding like you are a spiritual person,
yeah,
right?
a little bit. And that keeps me sane also. So that I always believe in God or the Almighty, and I always feel that I am trying my level best.
Okay. Your favorite food?
I've been brought up in Bombay. So thoda bahut I am a Mumbaikar kind of a person. So I like pav bhajis and maybe vada pav.
Okay.
And desserts always I cherish.
You know, this is a debate. It's a very common debate, Delhi versus Bombay when it comes to food.
Exactly.
So which side are you?
If you want more of variety of food, then Delhi has more.
Yes.
But if you, I have been brought up there, so your initial formative
nostalgia.
Years, there's a lot of nostalgia. And even now also, when my dad still stays in Bombay, so when he comes, sometimes he gets those vada pavs from there, and we always cherish those things. And even if maybe Bombay jata hu, so I always have those.
Do you get those sort of vada pavs in Delhi?
No, No, you can't have. You cannot have the similar chole bhature in Mumbai, जो
Correct.
दिल्ली में मिलते हैं.
Correct.
And you can't have, every area has their speciality.
Correct.
So you can never get that. वो नहीं होता है. वो उधर का जो टेस्ट है वो नहीं आने वाला है. इधर का टेस्ट आपको बॉम्बे में नहीं मिलने वाला है. That's why Delhi people जो बॉम्बे में जाते हैं, they have that problem. मोमोज का सवाल ही नहीं उठता यहाँ पे. And यहाँ पे I think so मोमोज is the most favorite snack जो खाया जाता है.
Yeah.
तो वो चीज़ है. तो it has to be area specific.
Okay. Your favorite vacation place or any place which you want to go but you have not been yet there?
I have been to Paris, but I would like to explore Europe more because I found Paris really wonderful. And maybe in India, I think so. My topmost has been Srinagar.
Srinagar.
Yeah, Srinagar. I've been to Srinagar. I've been to Sonmarg, Gulmarg, and Pahalgam, and absolutely wonderful and beautiful. No doubt about it.
Correct. You know, talking about Europe, if you do go there, do visit Amsterdam because that's my personal favorite.
Okay.
place.
Somebody told me Amsterdam, and even Scotland maybe.
Okay.
Scotland
Yeah. Right.
Yeah.
So, okay. Your inspiration in life.
My inspiration, I would say, my dad.
Okay.
Because he is a workaholic. Workaholic in that sense, not that I want to earn or something, but he can't sit. The point is, any Sunday, even if he has, today also, basically we are talking and he was having a free Sunday. Today he has gone to Mahakumbh.
Okay.
And basically he underwent an angioplasty last year, triple vessel disease. And once the angioplasty was done, he was in the ICU. The next day, once he was in the ward, he had his online court meeting. So he's a senior advocate in the Bombay High Court. So he was wearing his coat and he was attending that court meeting even in the hospital.
Wow.
And he doesn't sit. Any Sunday either he will go to some religious place and he will keep on working, and his ideas keep on, there are a lot of ideas which keep on coming in his mind. And I have my nephew who is now a Pradhan Mantri Rashtra Bal Puraskar awardee, as I told you. So he's that bicycle boy, Arun Bhardwaj. So it was my dad's brainchild. It was that he wanted to do something. So my inspiration is my father himself. He keeps on, he's so charged.
Because age is just a matter of the mind.
Yeah. He's 67 now, but he's so charged every time. I myself feel that I am half of his energy.
Wow.
So maybe he is an inspiration for me.
Okay. A philosophy that you live by in life. I think by now I have got one of your philosophies.
Yeah, so that is something which I really do. So I don't take too pride in my success.
Yeah.
And I don't get disheartened by my failures.
Okay.
So that is something. And the second thing is basically try to be as happy as possible. Sometimes just running behind everything, we are just trying to, either it's money, either it's fame. Therav. You need a little bit of an introspect. बैठो, सोचो. किसी चीज़ के पीछे पागलों की तरह पढ़ने का कोई फ़ायदा नहीं है. So you need to have that stability in your life also. Yes, you need to be ambitious. You need to be having the will to excel. But yes, you need to have that therav also.
Correct. Okay. If you could be an animal for a day, which animal would you choose and why?
I guess it would be tiger.
Okay.
Because a tiger is basically fierce, yet quite agile, and extremely immense strength, and it has that aura.
Correct.
That aura is always there with the tiger, and it's a lone warrior. Though I always advocate a team is a good thing to have, yes, but it itself is self-sufficient to take care of almost everything. So if you have, so imagine one tiger, imagine 10 tigers together. So if your team has 10 tigers, so then
so winning team.
Yeah, absolutely. So that's why I think so. Tiger is something which has always fascinated.
Okay.
Yeah, that's something. If I could have become an animal, it would be tiger.
Okay, that's great. Last but not the least, if you could have one superpower, what would it be?
I think so. I already have. Yeah, basically because it's not just a statement. Because to be able to cure someone or heal someone, so it's a superpower which has been bestowed upon me, that has been given to me, and मुझे लगता नहीं कि to be able to save someone's life, उससे बड़ी और क्या even the superheroes क्या करते हैं? Superheroes भी वही करते हैं. Superman, Spider-Man, उनका काम क्या है? Eventually they try to save someone, and that is what I'm already doing. So I've already got that superpower, and I have to make the most out of it. So basically, I'm happy with the superpower that I have got. That God has given me, and I'll try to do the best to my ability.
Correct. Okay. So this was a rapid fire round.
And it went very slow. I'm sorry for that, but yes, there's a lot of discussion. But it's good to have that.
It's yeah, it went well actually.
Yeah.
So okay. So again, coming back to your field, I have this question in mind that if just in general talking about the medical field, what is that one thing which you can say is the best about being in this profession, and what is that one thing which is the worst about being in this profession?
Best, as we have already discussed,
The healing
basically.
part,
Yeah,
yeah.
the healing part.
Yeah.
And the worst, I would say, with time, the going down trust between the patients and the doctors, because that is why there's a lot of issues that once we have those patients who come to us, they have a lot of trust issues now, because as I told, a lot of Google gyan, a lot of advice from their peers that किसी ना किसी या कोई ना कोई experience तो हमेशा हुआ होगा. So you will always have certain black sheeps. Make no mistake, you will always have in every field. In medical field also there are there, but most of the clinicians, most of the doctors will do their best to the will do their will put an effort to the best of their ability. There is no doubt about it. Yes, the results might not be favorable at times. We, as I always tell my patients, they tell me कि आप तो भगवान हो. मैं कहता हूँ नहीं, मैं भगवान नहीं हूँ. I am a human being, and in my clinic also I have a picture of a couple of idols which are there, and I believe in that. It's not just to show or something. कि भगवान वही है. I am just one of the person. I am doing the job. अगर हाथ मेरा है तो जरिया उनका है. कर वो रहे हैं. I am doing it to the best of my capability, and I am happy with that. और यही मैं अपने patients को ही बोलता हूँ. And I am quite happy when they give their blessings. There are certain seriously elderly patients who are there. They give me their blessings. There are their happy relatives, their loved ones, who again give their blessings. They are very happy कि भाई सब ठीक हो गया, सारी चीज़ें ठीक है. And maybe that translates into whatever amount of success I have had in my life till now. I have a good, lovely family, 2 lovely daughters I have, and I have a good life, and I'm quite happy with that. So basically, this doctor-patient relationship has to be that has to be somehow rekindled again. The trust has to come back, and my request to all the patients, the viewers, or the listeners is that once you are going to a doc, have trust in that process. It's like going to God. जब आप मंदिर में पैर रखते
Even
हो या
भगवान
कहीं
भी
पे भी
आपको हमेशा वो नहीं देता है जो आपको चाहिए
एग्जैक्टली
होता है।
एग्जैक्टली यू ऑलवेज हैव दैट कंप्लेन ना. तो जब आप लेकिन आप मंदिर में रखते हो तो एक भरोसे के साथ रखते हो ना पैर. चाहे आप मंदिर में रखते हो, चाहे आप दरगाह में रखते हो, चाहे आप चर्च में रखते हो, तो आप उस भरोसे के साथ रखते हो, है ना. तो वो भरोसे के साथ आप आओ, एंड मोस्ट ऑफ द डॉक्टर्स, द क्लिनिशियंस विल नॉट डिसअपॉइंट यू.
Because sometimes, on social media, we keep seeing people abusing doctors, perhaps being violent with doctors just
Exactly.
because certain things didn't go well. And it definitely doesn't feel good. It doesn't.
Exactly.
Yeah.
Nee, and that has taken us also on a back foot. Because
Yeah.
I'll tell you why. Because of these all these issues that are happening and a lot of medical legal things coming up, we are also on our back foot. Sometimes where we could have been more adventurous. Adventurous means risk taking ability, where we could have done more कि यार ये पेशेंट को बचाया जा सकता है ये करके. बट कहीं ना कहीं पे इन द बैक ऑफ आवर माइंड इज के अगर कुछ हो जाएगा तो इसके बाद अटेंडेंट जो हैं वो दे विल फील दैट कि इन्होंने मार दिया या इन्होंने कर दिया. तो कुछ डॉक्टर्स ये भी होते हैं कि दे आर ऑन द बैक फुट कि यार नहीं, जब मेडिको लीगली क्लियर होगा, मुझे पूरा कंसेंट मिल जाएगा, सब होगा. आई थिंक सो इफ यू आर इनटू मूवी वाचिंग एंड ये, सो इट वाज, आई विल गिव एन एग्जांपल ऑफ मुन्ना भाई. तो उसके अंदर था कि फॉर्म भरा नहीं तो उसके पहले कैसे बचाएंगे. अब दैट फॉर्म इज अ मेडिको लीगल रिस्पॉन्सिबिलिटी, बिकॉज इन दैट सेम सीन अगर वो बच्चा मर जाता तो बाद में वही चीज मेडिको लीगल बन जाती कि आपने फॉर्म भी नहीं भरा, आपने एमएलसी भी नहीं किया, द पुलिस वुड हैव गॉट दैट डॉक्टर कि आपने क्यों किया, कैसे किया, ये सारी फॉर्मेलिटीज आपने कैसे मिस की. सो इट वाज अ लाइट टेक ऑन दैट थिंग. ऑब्वियसली कि इट शुड नॉट, तो कभी भी ऐसा नहीं होता है कि फॉर्म भरे बगैर कोई प्रोसेस शुरू नहीं होता है. आई वर्कड इन गवर्नमेंट हॉस्पिटल्स, तो फॉर्म साइड बाय साइड भरा जाता है लेकिन ट्रीटमेंट स्टार्ट कर दी जाती है. तो इट्स नॉट एज इट इज शोन इन बॉलीवुड मूवीज, दैट्स अ ड्रामेटाइजेशन व्हिच इज देयर कि हाँ नहीं तुमने फॉर्म नहीं भरा है तो हम तो काम शुरू ही नहीं करेंगे. तो ऐसा नहीं होता है. आप बेसिकली प्राइम जो फर्स्ट केयर, वो फर्स्ट एड केयर बोल लो या जो इमरजेंसी केयर है वो आप शुरू कर देते हो. यू स्टार्ट विद दैट इमरजेंसी केयर, साइड बाय साइड वो फॉर्मेलिटीज करनी जरूरी है. तो वही मैंने कहा जैसे कि दैट डॉक्टर पेशेंट रिलेशनशिप ना, द ट्रस्ट हैज टू कम बैक. तो दैट इज, और वो दोनों तरफ से ही होगा, वो हमारे तरफ से भी होगा. तो इसमें मेरे को लगता है कि कम्युनिकेशन हैज अ रियली बिग पार्ट.
करेक्ट.
कि एज डॉक्टर्स जब कोई पेशेंट इज गोइंग डाउन हिल, सो यू हैव टू कम्युनिकेट, एंड व्हेन यू कम्युनिकेट वेल, your patients, attendants, the relatives whom so you are communicating it to, they can see through your efforts. उनको
Correct.
दिखता है कि this man or this woman is trying it to his level best. they are happy with the effort which is being put. Then हो सकता है you might not have a favorable result, but still it doesn't matter.
And because of the communication वो transparency आ जाती है और जहाँ transparency होगी वहाँ trust अपने आप ही
Exactly. तो मैंने कई बार देखा है ना कि certain doctors are not that great at communicating well. Once कुछ भी haywire होता है ना, so they go into a shell. And that communication lacks. It is at that point of time कि जितना जो trust जो टूटना शुरू होता है वो lack of communication की वजह से होता है. So you need to have that communication, communicate, over communicate, and more importantly communicate correctly also. वो भी importance है कि आप क्या words use कर रहे हो. कई बार आप थोड़े से insensitive हो जाते हो. Don't be insensitive also. There are certain medical terminologies, there are certain things that the patient is about to die. You can't say that the patient is about to die. Yes, we are trying our level best. हम कोशिश कर रहे हैं. The chances of survival are quite less. That's the way of putting it. You can say कि हाँ, he's about to die, and the other way of putting it is yes, we'll try our best, and the survival chances are less, but yes, let's go for it. So I think so that communication skill is somehow missing. In fact, I had given one of the exams. It's called as an MRCS exam of England college, which are there. So it has a specific pattern, and in that pattern it has a Viva table regarding communication skill. And you have those people evaluating you on a kind of a patient, not a patient per se, a doctor himself who is as a patient, and you are supposed to counsel that. It was, I got one of my cases as you have as a junior doctor, you have come to know that the patient is having the attendant is having cancer, he has been diagnosed. How would you counsel their relative? So even that thing has to be a part of our curriculum. In my time it was not there. I think so now they have included it, and that is very important. A good communication skill, how you put forth those difficult news, or how do you put forth those chances, as I told you, survival, how we'll try to take that patient out of the emergency situation that they're in. So that communication is very important.
Because sometimes doctors, they unknowingly, they are the unsaid therapists as well of the patients.
Exactly. So basically when the patient comes to you or the attendant comes to you, they are not just looking for a medical cure. They are looking for someone who can understand the situation that they are in, who can empathize with them. Somebody who can, so when again that they say that you should not be too attached to your patient, that is wrong. You have to be. But yes, as I told you, that you should be only attached, but you should try your level best, communicate it to them. But yes, then too much attachment can be then the failure, as I told you. So then you can get disheartened by the failure. So basically be there for them, explain it to them well, and I think so then the trust issues, they don't come up.
Okay, so my next question to you is government versus private hospitals, because if I talk in the layman's terms, government hospitals बेकार है, private hospitals अच्छे हैं. What's your take on this?
नहीं, I'll not agree to it, because I'll tell you, जो जैसे मेरा education है, तो मेरी MBBS, मेरी MS जो है गवर्नमेंट हॉस्पिटल से हुई है. इनफैक्ट हमारे जो अर्ली ट्रेनिंग पीरियड होते हैं वो गवर्नमेंट हॉस्पिटल से ही होते हैं, बिकॉज उसका रीज़न ये भी है कि बेसिकली यू हैव अ लॉट ऑफ पेशेंट्स, योर एक्सपीरियंस इज लॉट. जैसे मैं साइन हॉस्पिटल में था तो देयर वाज अ कार्डियक वार्ड, एंड जो हम बुक में वी यूज्ड टू से कि देयर आर दीज हार्ट सिम्टम्स व्हिच आर देयर समथिंग कॉल्ड एज मर्मर्स. ओके, देयर आर सर्टेन साउंड्स व्हिच ऑन ऑस्कल्टेशन you can hear, and that can point out to what disease you're looking at without even investigating. So that word used to have every patient, but every murmur you will be having, which is written in the book amongst those patients, because it's the number of the patients who are there. So that's why there's no doubt, I definitely disagree to it that government hospitals bekar hai. The only problem is that government hospitals overburdened hai, because it's the population that we are dealing with. We are 150 crores, and government hospitals alone cannot take that load. So it is so overburdened that at time even a surgeon or a clinician in a government setup, he wants to help out, but once you are at one time, if in 3 hours you are having an 80 or 100 patients ka OPD, so you cannot do justice to every patient, and you would overlook things. So that is bound to happen, that is going to happen. You have so long waiting periods. There are cancer patients who get date for the surgery 6 months after. I have seen patients who are having certain diseases where the cancer survival changes even with a delay of 1 to 2 months, and even it's not their government fault, because their lists are so overcrowded, they cannot take care of all those patients at once. So they will give a date which is 4 months afterwards, and by that time the disease is already spread, it's already quite late. So it's not because it's not the expertise is not there, but the government hospitals are so overburdened. And when we say it's 3 months or 6 months late, let me tell you, there are outside, there is NHS, there is in Canada, there are healthcare systems which are even worse. Then you get even waiting periods as long as one year. Even patients from there, they have told me their personal experiences. We have gone to the emergency with so much of pain, they've just given us a painkiller injection and they have sent us off. And you continue with these painkillers. That is what has been told to them. So when we feel na कि यूरोप में तो इतना अच्छा होगा, यूएस में इतना अच्छा होगा, even the healthcare there is burdened, and when उनका तो population भी इतना नहीं है. So only the government setup can't take care of everything, and that's why there has to be a government and a private partnership sort of. Okay, this is one more point that I would focus upon, that कई बार क्या होता है, the doctors in the government hospitals, they try to say that कि we private में दिखाया है, they deliberately have told it is not indicated, not to be done, and I would say कि refrain from doing that. That is something which is responsible for having that bad patient doctor trust which I was talking about. तो कहीं ना कहीं पे ये जो इसको हम कहते हैं कई बार ना कि there is something called as professional juicing. ये एक टर्मिनोलॉजी होती है जिसमें एक कलीग अपने प्रोफेशन के दूसरे कलीग को tries to take him down. So sometimes मेरे पास कोई patient आता है, some patient who comes with maybe a complication or something, and the attendant or the patient relatives, they try to ask you कि whether it was justified, whether it happened because of his mistake. If I know that it was a known complication, so I refrain from telling that why it happened. We have to see what to do further. I tell them, yes, this is a known complication, could have happened, I don't know why it happened, I hope it was communicated well to you, and second, this thing could have been taken care of if he has not done more harm. So it is one more good thing. If he knows that that is my limit, and if he has referred you, there is nothing wrong with that. And if he has to, if you feel that the complication is known and he has done to the best of his ability, then you can always tell, I was not in a situation, that my disease process might have been really very aggressive sort of, and he did the best he could. But sometimes हम क्या होता है ना, हम basically उसी की खिंचाई करेंगे, उसको बोलेंगे उसने तो गलत कर दिया, and that's how problems start होती हैं फिर. एंड यही जैसे मैंने बताया कि गवर्नमेंट वाले कहेंगे कि भाई प्राइवेट ने ऐसा किया, हम प्राइवेट वाले जो है हम गवर्नमेंट पे बोल देंगे कि भाई उनके पास फैसिलिटीज़ नहीं है. फैसिलिटीज़ उनके पास भी है. इनफैक्ट आई टेक प्राइड इन दैट फैक्ट दैट द गवर्नमेंट हैज़ बीन सेटिंग अप सो मेनी एम्स इंस्टीट्यूट. इफ यू कैन, इनिशियली पहले हमारे पास सिर्फ एक सिंगल एम्स दिल्ली हुआ करता था. नाउ वी आर हैविंग सो मेनी एम्स. सो देयर इज अ लॉट ऑफ इनिशिएटिव फ्रॉम द गवर्नमेंट, एंड इवन इन प्राइवेट सेक्टर्स लाइक आई एम प्रैक्टिसिंग इन Delhi NCR. So we have a chain of Max Hospital, chain of Fortis hospitals. So there are a lot of private hospitals coming up. So it is a good time for healthcare industry, because from the patient point of view, you have such a large population which can be catered upon by the government as well as private. So that's why we have to work in tandem. We cannot look upon the government sector and the government cannot look upon the private sector. तो वो करना ज़रूरी है, एंड साथ में चलना है. बहुत सारे ऐसे क्लिनिशियंस होते हैं जो गवर्नमेंट प्रैक्टिस, दे लीव द गवर्नमेंट प्रैक्टिस, कम टू प्राइवेट हॉस्पिटल्स, एंड दे प्रोवाइड देयर एक्सपर्टीज. सो देयर इज नथिंग रॉन्ग विद दैट.
Wow, so you actually explained this point very well, bringing in a lot of angles to it. Okay. मूविंग ऑन टू द नेक्स्ट क्वेश्चन. हमने एडवांसमेंट्स में रोबोटिक्स की बात करी थी, रोबोटिक सर्जरी. सो उसके बारे में थोड़ा सा और डिस्कस कर लेते हैं कि व्हाट एग्जैक्टली इज़ इट, लाइक व्हाट एग्जैक्टली इज़ अ रोबोटिक सर्जरी. कहाँ कहाँ पे अभी एट प्रेजेंट हम इसे यूज़ कर रहे हैं, कहाँ पे हम नहीं कर रहे हैं.
Yeah, so basically robotics, जैसे when we talk about open surgeries and then we go to minimally invasive procedures, minimally invasive surgeries. So these include laparoscopy, as I already told you, keyhole procedures. So it is an advancement to a laparoscopy only. So it is again a keyhole procedure which are there. The hole size are smaller, and the surgeon per se is not operating by the side of the patient. So what you have is you have certain robotic arms. Okay. So these robotic arms are holding those instruments. Which in laparoscopy were held by the surgeon himself. So those instruments go into the abdomen of the patient, the tummy of the patient, and it is controlled by the surgeon from a little bit away from the patient side. So you have a surgeon console. So if in layman's term, if I want to explain it, so it's like playing a video game. So basically you are sitting away from the patient, you are controlling those robotic arms, and you are operating. So the operating person is the surgeon only. Okay, the only benefit is that you have better precision. You have certain robotic instruments which have, when they talk about freedom of movements, like the hand. So laparoscopy has limited freedom of movements. Lekin the robotic has 7 degrees of freedom of movement, which is almost like the articulation of the hand. So it can pinch grasp, it can rotate, it can turn this way, that way. So that kind of movement you can have in robotics. So your limitations of laparoscopy are taken care of. So that's why, and even in the old surgeons who are basically seniorly aged, so these robotic platforms, they filter the tremors which are there. So you might be having senior surgeons who are 65, 70. By the age, everybody has known that we have a shaky hand a little bit. So when we are doing open surgery or laparoscopy surgery, these shaky hands can be a little bit of a problem. But these tremors are filtered when you're doing it on a robotic platform.
Okay.
And at this point of time, we are not having a single robotic platform. There are multiple robotic platforms which are coming up. So you have those slightly cheaper alternative also, but not compromising the quality. So that's why it is exciting time, as you told me, what are the advancements. So it is exciting time. We are having good robotic platforms which are available, and they have simplified the same open or a laparoscopic surgery. So all the procedures like maybe a weight loss procedure or a GI surgery, cancer surgeries, or maybe hernias, complex hernias, maybe even complex gallbladders. So all the abdominal surgeries which were not in my specialty but in Euro specialty, you can have nephrectomies, kidney removal, or you can have transplants, or uterus removal, which is hysterectomies, or prostatectomies, prostate cancer surgeries. So all these can be performed robotically. The only thing is because of the evolving science and the R&D which is involved into it, the cost is attached to it. So
Correct.
obviously that cost it is a little bit of a deterrent factor, but basically because of the increase in the demand, now there are more robots which are coming up which are slightly less cost effective, as we can put it. So they are more cost effective from the patient point of view. So we have to realize that we have to one size doesn't fit all. तो ऐसा नहीं है कि इस पेशेंट को मैं रोबोटिक कर लूंगा, हर एक किसी को मैं रोबोटिक कर लूंगा, हर एक को मैं ओपन इसको लैप्रोस्कोपी करूं. You have to decide किस पेशेंट के लिए क्या मायने रखता है, and you have to explain it to the patient and then let them take a call. So I tell the patient कि भाई I can do it laparoscopically, I can do it robotically, I can do it open. These are the benefits vis-a-vis open and lapro and robotic. You decide what you want to do. So leave it to the patient's wisdom later on. Lekin yes, as a clinician, as a surgeon, which I have learnt in my practice, you should try and have everything in your armamentarium.
Correct.
तो आपके तर्कश में सारे तीर होने जरूरी हैं. उसके बाद कौन सा चलाना है, that call is yours and in unison with the patient himself.
Wow. Okay. Okay, I think this was it. But before ending the podcast, one question that I definitely have in mind is, what is that one message that you want to give? Because this is a health special podcast with you. So what's that one message that you want to give to everyone listening to us?
Okay. So basically, I would want to, the first message would be there are no shortcuts to a healthy lifestyle. So try to stay healthy, value the life that God has given us, a good maybe dietary habit, a good schedule, plan yourself well, and exercise, as I told. The second would be, as I have emphasized upon, a good doctor-patient trust relationship. So have that faith when you go to a doctor, when you go to a hospital, have that faith in your doctor. He will try his best to cure you or to make you better. And lastly, try to stay happy. Stop running around. Basically, live in the moment, as they say. So basically, try to be to stay happy, to be stress-free, be away from stress as much as possible, and a healthy lifestyle. That is something which is very important. We have seen that the life expectancies have gone down. A lot of medical problems and issues are there. It's all basically a lifestyle which is basically too hectic, too stressful. So stay happy and enjoy.
Okay. On that note, I think we'll end this podcast over here. It was very, very nice having you. I hope you had fun with
Absolutely,
the podcast.
no doubt, no doubt. I enjoyed.
Because I know, being a doctor, your time schedules are all very packed up. So you took out this time to to make this podcast. So thank you so much for that. Hope to see you again. And till then, take care.
Thank you.
Yeah, thank you.